Hello. Thank you all so much for joining today as we try to bring awareness for suicide prevention. My name is Ethel Barrett. I am the Kinston Community Health Center Behavioral Health Practice Manager. And as we went through this month, we wanted to just discuss with the community and allow people in the community to know that you are not alone and that there are services and there are people out there that can help you. So today I have two professionals here. I have Miss Janine Russell. She is our doctor of nursing practitioner. She's also a psychiatric mental health practitioner. And she'll be joining us, as well as Alicia Whitfield, who is a licensed clinical social worker. She's here as well. So I welcome y'all today. We have professionals here to discuss mental health, depression, suicidal awareness, understanding that it is out there and it's actually happening in our state, in our county. And we just want to let people know that there is hope out there and that there's a way around this. So if y'all could please, take a little few minutes to um to just introduce yourself.
Okay. My name is Alicia Whitfield, and I have been in the practice of mental health for over 30 plus years. I did 30 years as a psychiatric inpatient social worker at Cherry Hospital.
Mhm.
And my last 5 years, I've worked outpatient as a social worker, mainly with adults and seniors who suffer from depression and other comorbidities, uh, bipolar, and things of that nature.
Okay. Well, thank you so much for joining us today. And Miss Janine, could you give us a little
Uh,
background about yourself?
okay. My name is Janine Russell. I have a doctorate in nursing. I'm a psychiatric mental health nurse practitioner and I'm board certified. I have over 28 years in the nursing field, and the last 5 years has been as a mental health nurse practitioner. And I'm a provider here on the mental health unit at Kingston Community Health Center.
All right. Thank y'all. So we wanted to just do this and just ask some questions, just a little Q&A to get the information out there. So I'm gonna ask some questions and you can chime in whenever you like to and just answer some of those questions. So I guess the first question is, a lot of times when we're dealing with depression and suicide, there's a lot of myths and different things when it comes to mental health. What do you think are the most myths and misconceptions about mental health and getting treatment about for mental health?
What I would say is one of the a myth that is out there. If someone is determined to die, people often say there's nothing you can do to stop them, and that's a myth. You can point people in the right direction to get intervention and support and treatment that can actually save their lives. So that is
Mhm.
a great myth.
Yeah.
In addition to that, there's a myth that if people talk about suicide, it increases the chance for them to do it. That's not necessarily true. That's not true because discussing suicide can actually prevent it from happening.
Yeah. So you think the more they talk about it, that's when they feel like they're actually saying, "Hey, I need some help. I don't know what to do. This is what I'm considering. If I don't get the help I need, is that what you think that most of that comes from?"
Correct. And a lot of people think another myth is that suicide can't be prevented. It can be.
Okay. All right.
And another one is suicide happens without warning. While it can sometimes seem sudden, most people do show signs through words, behaviors, or mood changes. So that's a myth. It may be sudden, but there are some signs that we need to look for. And also another myth is only people with mental illness think about suicide. Well, most people and a lot of people, not just people who have mental illness, may have some thoughts or feelings surrounding an ambivalence about suicide. So that's a myth that is
And
that only people with mental health thinks about suicide. That's not true.
Yeah.
and another one that's a big one. They're saying teenagers and college students are the most at risk for suicide. That's not necessarily true because research have shown that as the middle-aged people who are more at risk because they reach a point in their life that they thought that they should be further ahead than where they are now. So they're the ones most at risk for committing suicide.
Okay. All right. Well, thank you so much for that. And so, when you say that we talk about the myths and things that prevent people from seeking help, do you think when they start feeling those things like Dr. Russell, you said that people start to feel like they're not at the point where they should be in their life, so they start thinking about those things, and at that point, that's when they should probably start to seek help as well, right?
Correct.
Yeah.
Correct.
Okay.
Once they start, thinking along those lines, you can start asking questions to see, try to get to the root of the matter.
So if you see someone and as a professional, you see someone and you thinking, they're showing signs of suicide, that they may be thinking of suicide. What are your thoughts on that? What are some things that you think we can do to help that person, or you as a professional, what are the things that you would do?
Ask questions, you know, conversation plays a critical role in preventing suicide. So when you ask the pertinent questions, like, have you ever attempted? What are your thoughts on suicide? Do you know anyone who has attempted suicide in the past? There's several ways of trying. There's certainly like hanging or cutting. Sometimes people just do that to gain attention.
Okay.
So we have to find out what the root cause is, and then we can give them help. Most certainly, call 911. There's a suicide prevention hotline, things like that we can do.
Right. And you want to ask these questions in a non-judgmental manner. Um, Really, if it's your loved one, if it's a family, you want to ask them, are you really thinking about hurting yourself? You ask them that. Are you thinking about suicide? Listen and offer support and let them talk about their feelings. You want to stay calm. You want to show empathy. You don't argue with them. Um, and certainly don't leave them alone if they're home and they're thinking about this. You want to secure the environment. That means if you think there's a weapon or anything that they could use to hurt themselves, remove it. And then you want to proceed and encourage professional help. Contact your local mental health profession, mobile crisis line, 988 lifelong line. And take them to the emergency room or either call 911. Each situation is going to be different according to what's going on.
Right. And so there's also, we have the stigma, we have the myths behind seeking mental health. So what do you think are the barriers that are preventing people from seeking the help that they need? What do you think those things are?
Well, one of the biggest barrier is stumping out the shame and stigma. Shame and stigma keeps people from seeking help. Their fear of being judged. It could be a cultural or family belief that they have why they won't seek help. lack of awareness or recognition, not realizing that what they're experiencing is really a mental health condition.
Yeah.
Um, and access availability.
Mhm.
Depending on if they're in a rural area, they may
Mhm.
not have the access to treatment.
Okay.
And in addition to that, a lot of times people want to handle the problems by themselves. It could be a financial constraint why they don't seek help, limited access to service, um, misconception about help, things like that.
Okay.
And also, a shortage of mental health staff.
Yeah.
Mental health clinicians. We have a shortage sometimes. Knowing that they're going to be in a long wait line or be in the ER a long time. Those
Right.
can be some barriers. And like she said, lack of affordable care or insurance coverage. That financial barrier, high costs of therapy and medication,
Hmm.
and past negative experience with the healthcare.
Yeah.
Concerns about confidentiality. You'll be
Right.
surprised at people that think, well, they don't want to talk about what's going on because of they think that we're going to tell, but it's confidential, and we are bound to that to not talk about that.
Yeah.
Um, and so those are some of your barriers that you have.
Yeah. And so what I would think vulnerability, people are, they don't want to feel vulnerable in some situation.
Mhm.
They feel like if they come to a person and they are basically letting their thoughts, things that they've been thinking or things that they have been going through, and that they're actually showing a side of vulnerability. And
Yes.
so a lot of times I think that's sometimes that can be a reason why people just, like I'm not going to seek the help that
Mhm.
I need right now. Or
Yeah. Yeah.
yeah. So I know that was actually one of the questions that was in the chat. So I just went on and asked that because that was the only question. And thank you, Carrie, for asking that question. So as I look at some of the other things as we go in, and as you say, people, not everyone with a mental illness can have that point of where they feel like they want to commit suicide or feel depressed or down on themselves. So at this point, what can people who are non-clinical do to help? We as humans, we may be a family member, but sometimes we like, I don't have that certificate. I don't have that degree to go and try to help them. I don't know what to do. So what can they do as a non-clinical person that wants to help someone?
When you say a non-clinical person, are you meaning help in terms of making stuff more available,
Yeah,
or
what can they
is that what you mean?
yeah, so what can they do to assist them to getting them, I guess, to getting them to help? Because it wouldn't be, they if they see someone that's trying to, they may be considering it, what can they do in that moment? What could they do to assist with that? Because, if you're a person, even though you're not licensed, you still want to be able to say, I want to help them do something. I want to be able to get them to this place or something like that. So what would
Well,
you say? What would be the best option for them?
I would say the best option really would be to talk to their loved one and try to, first of all, they may want to have them evaluated by their primary doctor.
Mhm.
And a lot of times, the primary doctor will do a PQ9, a patient questionnaire evaluation, and it will have some of those things in that questionnaire that will alert this patient may need some behavioral health intervention. So one thing that we want to do is expand access points, integrate mental health into primary care, and
Mhm.
that's that integration comes in.
Yeah.
Yeah, most of the time, just adding on to what Alicia just said, the primary care doctors or the primary care providers are the first one to see someone with a mental health diagnosis or illness. But there are also peer support workers. They're also knowledgeable in mental health and substance use. So they're a good source is the non-clinical mental health workers.
Right.
Yeah, behavioral health aides. You also have community health workers like ourselves and patient navigators. Those are some of the other non-clinical mental health workers that can help.
Okay, so all right, so just going through that, and you spoke about being a more accessible. So what do you think as a healthcare organization, how can we make it more accessible to people? You know, if they don't have a way of, getting to getting the access to the care, what do you think as organizations and community organizations should do to make this more accessible for the people in the community?
Well, as I said earlier, you want to integrate mental health into primary care. That's where your integration comes. Also, we use telehealth and virtual help for people that don't have transportation. You can see them through the telehealth, which is very good for them that don't have transportation. Transportation offer sliding scale and low cost, which I think we do, but a lot of
Mhm.
places don't.
Yeah.
But that would be good. Um, um, Transportation is a big barrier. If we can try to help with transportation, giving them a token or something to get to these appointments. I know we sort of in a rural area, but a lot of places offer bus passes for patients
Mhm.
to come. If they're Medicaid, they can usually, if they call within a certain number and call a Medicaid number, a line, they will try to access them to get to their appointments. Creating a mobile crisis team right there. You know, we don't have mobile crisis, but if we had a mobile crisis team, that would be great. Um,
Mhm.
Providing that service to them. Um, Offering crisis stabilization. Looking into safe housing. All those things that can help with having access to services needed.
Okay. Well, that's
In addition to that, you have like what we can provide also is like community education and awareness,
Mm-hmm.
mhm.
community engagement.
Mm-hmm.
Like I said before, we could offer peer support and the telehealth and telemedicine, like Alicia alluded to.
Yeah.
Yeah.
And also creating a crisis text line
Mhm.
for them. Uh, and just equipping them and like she said, and teaching and educating first responders and pastors and teachers, coming together with the faith-based community and working together um, with education and if there's some services they had that we can use that.
Yeah. Yes. And I think that's an organization, the faith-based organization is definitely one thing to get that information out there. We have another question in the chat. It said, how do you address the topic with teenagers you feel are going through symptoms of depression? How do our teenagers, they're going through a lot, it seem like. And so
Mhm.
how do we work with them and talk to them about, this about depression?
Well, education. education is a great piece. Um, it can be done on several levels. You can start with the school and talk with the school counselor, and maybe the school counselor can actually do an education piece within the school, and then the parent could maybe bring the parent in or parents in and be a part of that and
Yeah.
evoke conversation. Um, so that's where I would start.
Yeah. And you want to also make certain that wherever they're living, that there's no access to, you know, weapons, because that's so easy for them to do. Drugs is another, you know, method that they think about. Peer pressure is one of the biggest ones.
Yeah.
You
Right.
know, so
And when I say school, most schools have school social workers. So I don't quite know their role, but that's a role to use the school social worker to
Mhm.
actually pull the child out and talk with them. But if they don't want to bring them home, make them uncomfortable,
Yeah.
education, especially like this month.
Yeah.
This would be a great month for schools to do things.
Mhm.
I know May is Mental Health Month, doing stuff in May with the
Yeah.
whole school system and bringing someone in to talk with the kids. Because
Yeah.
believe it or not, that will cause them to ask questions.
Yeah, and I think that's a good idea to get some of the community organizations into the school, working with the youth, and having them to do certain activities or and make it a topic, make it a discussion, because it may you never know, one day you may be that one particular child may have been thinking about that situation all day long, and just bringing it up and having a discussion about it and trying to talk out their feelings, and maybe that could save somebody's life, save a child's life. Because as I was looking at some of the data for North Carolina, and it says the age range, the highest numbers are between the ages of 10 and 24. Those are the highest numbers for the suicide rate in North Carolina. So we definitely have to make sure that we're talking to our teenagers. We're having that discussion. We are giving them a platform to be able to discuss their feelings and discuss what's going on. As you know, social media does a lot for the teenagers that we around, around this time. And so we want to make sure that we are actually giving them a platform and letting them know it's okay. It's okay you having these feelings. Let's talk through these feelings and things like that.
And for if being a parent, if you're a parent, just checking in with your kids on a day-to-day basis. How are you
Mhm.
feeling today? How was your school today? And if you see a kid that may be showing signs of some sadness or depression or not participating in activities that they used to participate, ask them in a non-judgmental way, would you like to talk to a therapist? If they can't
Mhm.
talk to you or you don't think that you can talk to them, just say, would you like to meet mommy or daddy to make an appointment just to talk with a therapist?
yeah.
Yeah, yeah. And so I don't see any more questions in the chat at the moment. Um, is there anything? So when you're thinking about you, like Miss Alicia, you said you've been doing this for many years. Um, Dr. Russell, you have been doing this for many years in the mental health field. What is your purpose? What do you feel is your purpose into this field? What do you feel that keeps you going and keeps you hoping, keep you continuing to do this job? What motivates you to keep doing this?
Well, that's a good question. And what motivates me is giving people hope, giving people hope. When you give them hope, you're going to see less sadness, less depression, less thoughts about suicide. So giving people hope and resilience. Hope is the pendulum, is the door that swings upon preventing depression and suicide.
Mm-hmm.
Yeah.
So my goal is to give them hope and encouragement and
Yeah.
support and coping skills and strategies to manage their whatever they're going through.
Okay.
I agree with what Alicia just says. Um, I give them hope too, although I don't see a lot of teenagers, but what worked for the teenagers can work for the adult as well. Um, Hope does foster resilience. It it is an invaluable spiritual practice that helps us maintain our individual and family Mental health. It is not just a fleeting emotion. You know, when you give people hope, you give them a reason to, survive. So for me, I want to give them, a reason to say, okay, let's talk about this. And, during the discussion, they themselves sometimes just come up with ways, like Alicia was saying, I know with when they see the therapist, they come up with a lot of times they come up with their own way of, preventing, like cognitive behavior therapy, where they can talk about their feelings and ways to get around it. So those are some of the feelings of hope that I would encourage my clients with.
Yeah. And when people have hope, they're more likely to reach out for support and treatment. And from that hope comes resilience, ability to cope with stress.
Mm-hmm.
Resilience helps people adapt to changes because people may just be going through some changes
Mm-hmm.
and they need that hope and that resilience to process that change or that
Mm-hmm.
trauma
Yeah.
without feeling overwhelmed to the point that they become despair.
Mm-hmm.
Resilience, it helps build problem solving,
Mm-hmm.
and it can be built through learning ways to manage those emotions. So yes,
And hope also help to refrain negative thoughts.
yes,
Um, it gives an emphasis on strength. It increases self esteem and self awareness.
Yeah.
yeah, and hope and resilience together acts as a buffer against suicide through helping people manage setbacks. Hope is being able to see that there's right despite all of the darkness. Resilience is knowing that you are the only one that has the power and responsibility to pick yourself up.
Yeah. That's well. We have one more questions in the chat. It said, "What are some simple everyday practices people can use to care for their mental health?" I know we discussed May is Mental Health Awareness Month, and we discussed how some of the things that we can do just to be aware of our own mental health. Sometimes we can run so much. We working with our kids, we're taking care of our husband and wives, and then sometimes we just forget about those things. But what are just some simple day-to-day activities that we can do to make sure that we're aware of our mental health and take care of our mental health?
Well, daily self-care practices that you enjoy. It could be lighting a candle, mindfulness meditation. When you're feeling overwhelmed, just stop and look at 5 things I can see, 4 things I can hear, 3 things I can feel, 2 things I can I can taste, and one thing I can smell. Taking that time every day, if it's not but 5 minutes of the day, to be still and practice mindfulness. I tell my patients, don't get up and be in a hurry. Take time for you in the mornings. Get up so you can meditate and do that mindfulness. My
Mhm.
mindfulness is my cup of coffee. Every morning, I sip my coffee and I try to not be rushed when I do my coffee. I try to be ready to work, but that's my mindful meditation. When I take a bath, that's my mindfulness meditation. Using aromatherapy is a great way.
Mhm.
Reading. When you go outside, just be mindful of what's around the sky, the trees, and the colors on the trees, and the grass, and the birds, and the everything. Be mindful and just taking time out for you. If it's not but 5 to 10 minutes every day, just for you, and do that one mindful thing for you.
Mhm.
Okay. And in addition to that, just breathe.
Please,
We say
please.
that so often, but just breathe.
That's what I said. Breathe.
Yeah, just
Yeah.
breathe. Taking time out for yourself. I mean, you might not do it often, but get a massage. I like the aromatherapy myself. On the
Yes.
week, maybe just spend an extra 15, 20 minutes in bed. Just, clear your thoughts. Things like
And practicing daily affirmations. Think
Mhm.
it every day. You write down something positive and think positive. When you like this presentation, I told you can do this. You can do this, Alicia. You're gonna get through it. Sometimes you have to do it a little scared, but you do it.
Yeah.
And you practice that mindfulness and send those positive affirmations
Mhm.
to help you get through your day.
Yeah.
Yeah.
So that is awesome. I know for my mindfulness, I usually, whenever I want some quiet time, I usually will just ride on my way to work. I'll ride with no music, no phone, no
Right.
anything. And
Right.
just all I want to do is just
Be still. And
quiet.
be
Yeah, be
still.
quiet, just
Mhm.
quietness and just take in the scene, take in, everything that I have going on and just kind of relax a little bit before I even get to work.
Yeah.
So that's some of the things that I like to do. And so I appreciate each and every one of you for joining us, everyone who came in to the Facebook
Thank
Live.
you. Thank
And
you.
I appreciate Miss Alicia, you doing this. I know I kind of sprung this on you and Miss Janine, and y'all came in. It was like helping out, and I appreciate that so much. It's definitely noted.
Thank you.
And
Thank you.
and so, one thing I do want to say is that we as Kinston Community Health Center is a FQHC. We offer behavioral health services, we offer therapy, we offer med management, and we also offer substance use treatment. With all of these services, we do offer a sliding scale. And so with that, that's something that you can, which makes it what one of the things about Kinston Community Health Center is that we are trying to be accessible to the people in the community. We want you to come and get the service that you need and the services that we provide. So at any point, if you're needing that service or you needed someone to for therapy or um, med management, don't be afraid to call Kinston Community Health Center. That number is 252-522-9800. But most importantly, if you ever feeling like you are having issues and thinking
Reach out.
thinking about suicide, don't you can call or text 988. That's the suicide prevention line. Please call them. And once you speak with someone, also follow up on that. You just going back and following up and getting the services that you need to make a better, stronger you. So is there any other things that you would like to throw out there, Miss Janine or Miss Alicia, as we wrap this up?
No, just help is here. If you need
Yep.
help, get help. And if there's something we can't do or we don't do, we will link you to the right person or
Right.
services that you need.
Yes, and don't be afraid to ask for help.
Yep.
The question you don't ask might be the question that, is so relevant.
Yeah. So again, I appreciate you all and thank you so much for joining. And we will try to have that information on our website, on our Facebook page for the suicide prevention line. Thank y'all so much.
Thank you.
Thank you.